This is Debbie Bucher for Parkland College, and this is for the LPN to RN Transitions course, and we're using the text by Laura Claywell. And today we're going to be looking at Chapter 14, which is Leading, Delegating, and Collaborating. So as nurses, we are leaders, and we can influence patients, families, and others working toward a vision or a goal. We can empower others, communicate a sense of direction, as well as demonstrate self-confidence. Leaders empower those around them, and they are able to communicate the sense of direction and have self-confidence. Nurses can be leaders by volunteering on committees and belonging to professional organizations, as well as volunteering for leadership positions such as a resource nurse. The accomplishment of organizational goals and outcomes is contingent on the actions of leaders. They influence and interact and encourage coworkers and patients toward their goals. Managers who are responsible for guidance and direction, and followers whose collaboration and action are a vital part of the outcomes process. The RN is the primary responsible person of the healthcare team and for managing care for several patients. As an RN, you are not only a well-organized coordinator, but also a collaborator as well, so to deliver safe, effective care. As a leader, you have to be able to influence outcomes through positive interactions with the different team members. Defining the leadership role. To manage is directing or supervising others as a means to control a situation. Managing patient care means overseeing the plan of care and directing others to implement the plan toward the achievement of the desired outcomes. A manager has leadership qualities, acts as an advisor, and influences the beliefs of others. Characteristics of a leader. They are competent, they have trustworthiness, self-assuredness, decision-making abilities, and they prioritize skills. A strong leader assesses the traits of the team and directs them in a way that is the most beneficial to the care of the patient and the morale of the team. Competence is when an individual demonstrates competencies as performing at an expected level. The Institute of Medicine in 2003 defines professional competence as the habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values, as well as reflection in daily practice for the benefit of not only the individuals but the community being served as well. Trustworthiness is the ability to be relied on as honest or truthful. And I think it's the last 5 or 6 years, Routers has voted nursing as being the most honest and ethical profession out there. And of course, we understand why. We as nurses are caring for people's lives, which we take that very seriously. And we do want to be the most honest we can with our practice with our patients so that we can be trusted. Self-assuredness is confidence in oneself or in one's own ability and talent. Decision-making ability is able to make decisions with confidence. And the RN leader is decisive, practices sound judgment, and is able to speak well. Prioritizing skills is when a good leader is one who can prioritize well as be consistent. More tasks of leadership are envisioning goals, affirming values, motivating others, managing, achieving workable unity, developing trust, explaining, serving as a symbol, representing the group, and renewing the self. And as well, the RN is a leader and has self-knowledge, respect, trust, integrity, vision, participation, learning, communication, and catalyzing change. All need to respect and trust one another. The strong leader is one who is a critical thinker and a rational thinker. Management provides the structure and direction necessary to accomplish goals and outcomes that are known and when there is a system in place to achieve the outcomes. And again, a manager has leadership qualities, acts as an advisor, and helps to influence the beliefs of others. And again, they need to be decisive, use sound judgment and ability to articulate fluently, and display of integrity at all times. Managers and any staff member who bears responsibility for the work of others is considered a manager, whether you're in a managerial role or not. Also, anyone who must ensure the completion of an organizational process, and also one who guides the processes necessary to accomplish tasks necessary to achieve organizational outcomes. And again, managing patient care means overseeing the plan of care and helping to direct others on how to implement the plan to meet the desired outcomes. Followership is not a passive process, uses personal behaviors that contribute to the healthcare team's goals, demonstrates collaboration, influence, and action with the leader or manager to accomplish goals and outcomes. Should be willing to question, debate, compromise, collaborate, and act as well as be accountable for those actions. Accomplishing goals and outcomes are not only the manager's and leader's responsibility, but is the staff nurse's role as well. Leadership characteristics. Again, a leader has the ability to influence outcomes through positive interactions with the team members. Characteristics. The leader recognizes the strengths and weaknesses within the team, manages them to effect a positive outcome from a plan of care, empowers all team members to do the jobs of which they are most capable, and delegates assignments, tasks, and duties to the best individuals for the particular jobs. A strong leader has clinical expertise, team member respect, and critical thinking skills. A wise leader delegates tasks to the best individual team member and trusts him or her to complete the task correctly and efficiently. Defining the leadership role, managing is directing or supervising others as a means to control a situation, managing patient care and overseeing the plan of care, as well as directing others to implement the plan toward achievement of the desired outcomes. A manager has leadership qualities, acts as an advisor, and influences the beliefs of others. Leaders also have expectations and an earned role. And again, defining the leadership role, has expectations and an earned role, needs to be decisive, has sound judgment and self-knowledge, as well as, again, displaying integrity at all times. Next, different types of leadership styles. There is the democratic, which bases decisions on consensus or mutual agreement, delegates duties according to the strengths within the team. Autocratic is also called authoritarian, uses power to influence others and affect outcomes. Laissez-faire is non-directive, and they deliberately intervene as little as possible. Now, depending on the team composition and dynamics and desired patient outcomes, an RN's leadership style may differ substantially depending on each situation. The democratic leader delegates duties to the appropriate people within the team, outcomes. The autocratic or authoritarian leader uses power and assumes power without earning the respect of the team. This can lend itself to resentment, but it can help in a crisis situation, but probably isn't the best type of leadership style in order to have good outcomes, not only with the patients, but with respect within your team. And the laissez-faire leader, again, intervenes as little as possible. Team members are independently motivated, but they do seem to be cohesive, but chaos can occur if the individual needs interfere with the goals of the group. Leadership approaches are different approaches. Change is influenced through empowerment of the nurse and team members. The approach depends on the personalities of the team and situation. The RN incorporates one or more styles of leadership to meet the needs of the patient. Open communication is needed among group members, but again, communication is one of the hardest things to do well, I think, but we need to continue to work on that. Very important. Clear goals and objectives must be part of the plan of care, and each member must understand his or her role in meeting these goals. Another form of leadership style is transactional leadership. It's the traditional boss whose decisions are made without staff input, but motivates followers in three ways: offers rewards, monitors work performance and corrects the staff member immediately, and waits until a problem occurs and deals with it later. They rely on power and authority to reward or punish performance, usually found in stable work environments. But the RN style of leadership should reflect the personalities of the group members as well as respond to the situation. The RN, as manager of the care, incorporates one or more styles of leadership to meet the needs of the patient and with each different situation. So as a leader, you could employ several of those different leadership qualities. Servant leadership is another style. It emphasizes service to others, including employees, customers, and the community as a first priority, focuses on the needs of others, empathizes with them, and is attentive to the concerns of followers. It involves listening, empathy, healing, persuasion, awareness, foresight, conceptualization, commitment to the growth of people, stewardship, and building community. Quantum leadership is most effective at times of change and crisis. Strong moral purpose to make a difference, ability to establish and promote nurturing relationships, and approach decision-making through empowered followers. And the fundamentals requirements of a quantum leadership include, again, acting with moral purpose to make a positive difference in the lives of organizational members and society as a whole, building relationships that nurture both individuals and organizations, make truly informed decisions by acquiring knowledge through listening to and empowering members, according to the ANA. Question: a nurse is the team leader of a group. There's a problem with the patient, and the nurse asks the team members for their input and waits until the group comes to an agreement. Which leadership style is this nurse using? Is it democratic, autocratic, laissez-faire, or transactional? This indeed is democratic. The democratic leader bases decisions on consensus or mutual agreement within the group. So again, with leading and emotional intelligence, leading occurs within and outside of the work setting. The way we lead has an impact on followers, whether they are people in our community, family, or our friends. The leader's skill in dealing with people, motivating, giving feedback, and developing trust is crucial to success because others in the workplace are affected by the leader's behaviors and will have a tremendous impact on the team. And again, emotional intelligence has four major domains: self-awareness, self-management, social awareness, and relationship management. Empathy, caring, and the importance of developing the therapeutic relationship are familiar concepts to nurses, and these same concepts are found in emotional intelligence, refers to recognizing and regulating emotions in ourselves and others. Nurses must have good rapport with their patients, as well as the ability to understand patients' needs, and nurses can easily become emotionally drained, and the nurse must be able to recognize and manage his or her emotions. So while caring, empathy, and the development of the therapeutic relationship are nothing new to nursing, the concept is new within the context of leadership. Looking within ourselves helps us to interact positively with others. Given the complexity of the nursing profession, emotional intelligence becomes increasingly important, especially given the high stress environment of nursing. Nursing leaders are in an ideal position to demonstrate and apply the concepts of emotional intelligence in healthcare. So this is a win-win situation for patient staff, nurses, nurse leaders, as well as healthcare organizations. So emotional intelligence is very important, and that's all in your Laura Claywell text. Leadership has a moral or ethical dimension, and it has 5 principles of ethical leadership. They are serving others, showing justice, respecting others, honesty, and building community. And the leader's ethical responsibilities are to treat followers with dignity and respect, and be sensitive to their interests, needs, as well as concerns. Culture and leadership. Cultural competence extends to workplace as well. There are 4 generations in the workplace. The veterans, they value loyalty, respect authority, and want reward for hard work. Baby boomers view future with optimism and promise and desire to prosper financially and contribute meaningfully. Generation X are loyal to the profession, but unwilling to sacrifice for employer. Millennials have a tendency to be open-minded, collaborating, and civic-minded. Considering the cultural differences of the healthcare team is necessary in order to form a cohesive working relationship. Generational issues may be the hardest to overcome because of the differences in work habits, attitudes, and beliefs. Now we're going to be looking at delegation. Definitions of delegation are assigning tasks or duties to an entrusted individual, getting work done through others, and directing the performance of one or more people to accomplish organization or goals. The National Council of State Boards of Nursing Delegation Guidelines from 2016, responsibilities of the licensed nurse, responsibilities of the nurse leader and employer, and responsibilities of the delegee. Delegation requires the RN to know state regulations and scope of practice for those under his or her authority and whom they are delegating to. In delegation, the RN must build trust and be consistent, appropriate, encouraging, and compassionate. They need to delegate appropriate and difficult tasks to the most appropriate people and is available to assist others. Leader bases assignments based upon the individual capabilities, and people should understand this. A less experienced nurse will not have as complex assignment as a more experienced nurse. Every team member should understand each other's role. Next is a chart on the NCSBM delegation model from 2016. And regardless of the current role of the delegatee, whether it's an RN, LPN, or an unlicensed unit assistant, delegation can be summarized as follows. A delegatee is allowed to perform a specific nursing activity, skill, or procedure that is outside the traditional role and basic responsibilities of the delegatee's current job. The delegatee has obtained the additional education and training and validated competence to perform the care or delegated responsibility. The context and processes associated with competency validation will be different for each activity, skill, or procedure being delegated. Competency validation should be specific to the knowledge and skill needed to safely perform the delegated responsibility, as well as to the level of practitioner to whom the activity, skill, or procedure has been delegated. The licensed nurse delegates the responsibility but maintains overall accountability for the patient. However, the delegatee bears the responsibility for the delegated activity, skill, or procedure. The licensed nurse cannot delegate nursing judgment or any activity that would involve nursing judgment or critical decision making. Nursing responsibilities are delegated by someone who has the authority to do the delegating. The delegated responsibility is within the delegator's scope of practice. When delegating to a licensed nurse, The delegated responsibility must be within the parameters of the delegatee's authorized scope of practice under the NPA, the delegation model. Responsibility of the licensed nurse. The licensed nurse must determine when and what to delegate based on the practice setting, the patient's needs and condition, the state's jurisdiction and provisions for delegation, and the employer policies and procedures regarding delegating a specific responsibility from the NCSBN. The licensed nurse must communicate with the delegatee who will be assisting in providing patient care. Delegation is a delicate process that must be clearly and rationally considered. Among the issues that must be addressed are the condition of the patient, the skills of the team members, the appropriateness of the task, proper communication, and sufficient resources. The RN should follow the 5 rights of delegation to ensure proper assignment. The licensed nurse must be available to the delegatee for guidance and questions, including assisting with the delegated responsibility if necessary, or performing it him or herself if the patient's condition or other circumstances warrant doing so. The licensed nurse must follow up with the delegatee and the patient after the delegated responsibility has been completed. The employer must identify a nurse leader responsible for oversight of delegated responsibilities for the facility. The designated nurse leader is responsible for delegation, ideally with a committee consisting of other nurse leaders formed for the purposes of addressing delegation, must determine which nursing responsibilities may be delegated to whom and under what circumstances. And more responsibilities of the nurse leader and employer. You need to follow the policies and procedures for delegation, and they must be developed according to the NCSBN. The employer and nurse leader must communicate information about delegation to the licensed nurses and the unlicensed personnel, and educate them about what responsibilities can indeed be delegated. All delegatees must demonstrate knowledge and competency on how to perform a delegated responsibility. The employer and nurse leader must promote a positive culture and work environment for delegation. Very important. The delegatee must accept only the delegated responsibilities that he or she is appropriately trained and educated to perform and feels comfortable doing given the specific circumstances in the healthcare setting and the patient's condition. The delegatee must maintain competency for the delegated responsibility. Once the delegatee verifies acceptance of the delegated responsibility, the delegatee is accountable for carrying out the delegated responsibility correctly and completing timely and accurate documentation per facility policy. Issues in delegation include the patient's safety must always be maintained by understanding the scopes of practice and the skills and the abilities of the other healthcare team members. Delegating fairly does not mean delegating equally. So more issues to delegation. According to the ANA, 3 elements may not be delegated: the initial and subsequent nursing assessments that require professional judgment, determination of nursing diagnoses, goals, plans of care, and progress, interventions that require the application of professional knowledge and skills. Okay, in issues in delegation, If a person resists, then you must provide deadlines, but you want to avoid over-supervising. And first assess the reason for the resistance or refusal to perform a specific task, and then take the appropriate action to remedy the situation. Remember that if the patient has not been assessed by an RN, the delegation should not be occurring. Using trust and deadlines and proper supervision will foster confidence in those to whom tasks have been delegated. A fair delegation process takes into account tasks that have been already assigned, the scope of practice, as well as the experience. Collaboration. Definition is partnership arrangement between two or more individuals who have a mutual agreement to work together. Successful collaboration is when teams agree on the plan of care and the prioritization of the components of the plan, have excellent communication among the team members, as well as mutual recognition and respect. The RN must ensure that the plan of care is implemented, evaluated, and possibly modified so that the patient outcomes are the best that they can be. The RN is also responsible for directing the plan of care for the medical side. The RN must anticipate the medical direction, orders written, and foresee how they will affect the patient and patient care. The RN acts as an advocate in the medical plan of care as well, and carries out orders in a timely fashion, and making sure that you communicate important patient information to the doctor as well is part of the RN's responsibility. The RN must advocate for the patient by promoting the patient's decisions, communicating these decisions to the healthcare team, and developing a plan of care to meet the patient's needs. Working in collaboration with all members of the healthcare team, the RN should communicate effectively with the physician in charge of the medical plan of care, anticipate the information the physician will need to make informed medical decisions, assess the patient's reactions to treatments, and coordinate with the lab while keeping the patient's needs the top priority. Decision making involves making a decision that is focused on trying to solve an immediate problem. And problem solving is a purposeful and goal-directed process aimed at identifying and selecting options as part of problem solving, plan change, or improvement. The decision-making process includes defining objectives, identifying options. Oops. I'll continue to go on. I advanced the slide by one, so pardon me. But at any rate, decision-making process defines objectives, identifies options, identifies the advantages and disadvantages of each option, selects an option, implementing the option, and evaluating the results. All are important to remember to do. Effective decision-making and problem-solving process is you gather data. Oh, I think I already maybe said that. No, I guess not. Okay. You gather data from many sources, learn different approaches to problem situations, observe positive role models in action, talk to a colleague or superior who is an effective problem solver and decision maker, perform research to increase your knowledge base, take risks using new approaches to problem solving. You may need to perform research to increase your knowledge base. Oh, and again, trying to use different and new approaches to problem solving. Conflict management is this occurs when there's opposition of feelings, beliefs, desires, or goals. Types are interpersonal within one individual. Interpersonal is between or among two or more individuals. Intergroup is within one group. Intergroup is between or among two or more groups. Oh, intragroup is within one group. Intergroup is between or among two or more groups. Guidelines need privacy. You need to be willing to talk calmly and rationally, and if not, stop the process and discuss at another time and ask for help if needed. Conflicts can occur within or between people or groups and may affect patient care. Conflict discussion should be conducted away from the patient area and should focus on patient care and safety.
Very important. Sacrifice resolution is when someone accommodates the other by essentially sacrificing his or her position, thus allowing the other to have his or her own way. Competition resolution is when one or both of the parties work competitively instead of cooperatively toward resolution, where one side wins and the other loses. So again, the win-win resolution is a collaborative method. Parties come together to decide on mutual goals, and they work together to evaluate the outcomes. Sacrifice resolution involves compromise by one or both parties that can eventually cause resentment. Competition resolution also may cause resentment. Competition resolution pits team members against each other when they should be working with each other. Sacrifice, neither party gets all of what they want. If one party always does the sacrificing, then they may start to have resentment. And competition, the result is resentment or jealousy on one part of the person who lost. Clear rules must be put into place that direct a fair resolution. And last question, a nurse has a conflict with another nurse. The nurse meets with the other nurse and resolves the conflict. Which type of conflict occurred? And 3, it would be interpersonal between the two people. So that now concludes Chapter 14, Leading, Delegating, and Collaborating. Thank you.